So we're going to be talking about patellofemoral pain syndrome. So I have my adolescent female, our most common patient who has this condition. So if you remember, lots of different causes that will lead to abnormal tracking of the patella in the femoral condyles. So a few things that we're going to start with right away is stretching. So the main things you want to stretch are the IT band. So you would stretch that with an Ober's stretch, most likely. You want to make sure you stretch the hamstrings, and you want to make sure you stretch the quadriceps, okay? Easiest way to stretch the quads without compressing is to stretch the hip and the knee at the same time. So will you lay down for me on your back? You can come this way, okay? And come all the way to the edge. Perfect, go ahead and lay down. I'm just gonna bring this leg off the table, and we're gonna let this extend, and then we're gonna bend the knee back from there. You feel that pulling? Okay, don't help me. You're gonna Charlie horse, okay? That way I don't have to bring the heel all the way to the butt, but she's still gonna get a good stretch because we are stretching at the hip also. So that way we get the rectus femoris. Okay, we wanna make sure we stretch the lateral retinaculum. The lateral retinaculum is this tough little membrane that's on the side of the knee. Often it gets very tight with IT band tightness or with the patella that's tracking abnormally. So we want to do some patellar mobs. So we're going to want to especially do our lateral mob. If you can come in here and see this. And when I stretch her laterally, you can see I'm pushing into this tight structure. It's a stretch, so we would hold this at least 30 seconds. Okay, so basically it's a tough structure and I'm just pushing the patella into it to try to stretch it out. Okay, things that we're gonna avoid initially are low squats, and we're gonna avoid open kinetic chain exercises. With open kinetic chain, there is just more shearing, okay? They don't have good control at their knee joint. And without good control, whenever they try to extend their knee, that patella is gonna go all over the place. What happens when you're in a closed kinetic chain is you get co-contraction. You get much more stability around the knee joint, and it's much better tracking, much safer, because we're keeping them in a limited range. Okay, so jump up for me, patient. Okay, we've stretched her. We've told her don't go real low. It's gonna hurt if you go real low, okay? But we're gonna start her immediately on some closed kinetic chain exercises. So go ahead and stand up for me. And you're gonna stand here at the table and just turn around, okay? And you're gonna do a squat, and I want your feet about shoulder width apart. And when you squat down, I want you to sit your butt way back like you're sitting in a chair that's behind you, okay? And you're just gonna come down like halfway to a chair. Not all the way down here, just right about here. Okay, small squat. Good. Okay, now when you do that, I want you to look down. Okay, do it the same thing you did. Okay, well that was better. Okay, whenever you do a squat, you don't want your knees to come forward over your toes. Okay, you should always be able to see your toes. Okay, go ahead and do it again for me. Nice. Okay. This could be neuromuscular reeducation, 1 set of 10. If she was weak, it could be strengthening. We would have to see what she needed. Okay. Another thing we can start with would be mini lunges. So very, very small. Okay. And we could do single plane. Okay. We could do retro. We can do low steps. Come on over here for me. And what you're going to do is you're going to stand up here. And you are going to heel tap, heel tap, heel tap. Okay, you can hold on here for balance. What I'm going to be doing is looking at her knee. If you can come over here, camera person. All the way over here. You're going to want to be in the front. Okay, go ahead and start. Good. Okay. And yeah, can you do it badly for me? So when you come down, I want you to kind of let this hip, let me me show you. Well, not like that. Can you just let it your knee kind of collapse in?
Tried.
She's so good she can't even do it. Okay, so let this one come out. When you bend, can you let this like that?
Okay.
Okay, try it. Okay, that's what most of your PFPS patients are going to look like. So what I would do is I'm going to put my hand here. As you tap this heel down, try to keep your knee pressed into my hand. Okay, you don't have to go over. You're fine right where you are. Okay, she's overcorrecting. Because she was fine to begin with. Go ahead down. There you go. Okay, good. Okay, we're going to keep it small. Okay, we go through this phase. We stretch what's tight. We start educating what isn't firing correctly. We try to get the timing right. Modalities, ice, avoidance of things that hurt should calm her down. Within a few weeks, we kind of reassess and see, can she now go to that 60 to 90 range and it not hurt? And if she can, now she's in mod phase. So in mod phase, we're gonna let her do motions, pretty much the same stuff we've already started, but lower down, okay? Going past 60 degrees of flexion towards 90. Okay, so that means taller steps, maybe a 6-inch, maybe an 8-inch, depends how long her legs are, okay? We're still not doing super high level of balance, but we can start some basic balance, some basic reaches and single leg. Always remember, if she doesn't have good hip control, which she probably doesn't, and we put her single leg and she can't hold it, what's going to happen at the knee? Okay, so we're starting basic balance. When she's showing me good hip control, then we're in min phase. So good hip control, good alignment with everything we've tried so far, no pain all the way down to 90 degrees. So now in min phase, we can go past 90. We can go to plyometrics. We can go to triplanar, okay, agility ladder stuff, okay? One of my favorites is to have them do diagonal lunges. So my patient, okay, what you're gonna do is you're going to lunge kind of towards the camera and put your hand down on the floor.
With this leg?
It does, well,
This leg out?
this one.
Oh,
This one, your left.
oh, sorry.
That's okay. Good. And come back up. Okay, do it again. Okay, when it's a diagonal lunge, she's having to use her sagittal plane and her frontal plane muscles all at the same time. We can also do, this is a little tougher. I'm going to move this out of the way because it takes balance. What you're going to do is you're going to turn behind you and do a lunge. I don't care. Okay, don't make it completely behind you. Make it out at an angle. There you go. Nice. Okay, and come back. And try to do it all in one movement. So down and up. Down and up. Okay, that's really working her hip stability and her balance in a triplanar way. Okay, those are the basics. There aren't real timelines. It's really just about what your patient can handle and when. Most important thing is don't flare them up. Don't bring them backwards. Okay, and then keep an eye on flexibility and patellar mobility through the whole thing. That's it.